everybody, my name's Alyssa with Workout with Alyssa, and today I just wanted to bring a couple tips to mind post double mastectomy or reconstructive surgery after you've had breast cancer surgery. So a couple things that you just want to keep in mind, that when you are going to have the surgery, you want to be able to continue your exercise routine up until the day of surgery. So there's no need to stop what you're doing. You'll actually help strengthen your muscles and continue to increase your flexibility if you can keep your physical activity levels the same. And then, with surgery, of course, you need to listen to doctor's orders because they're doing a lot with removing lymph nodes and messing with the nerves that are going through the chest area. And that's it's hard for a lot of people for any type of surgery, but especially with breast cancer, you're always a little bit scared. Did they get it all? And things like that. So it is important through the healing process to make sure you follow doctor's orders. Now, in the first couple days, they're really not going to have you do too much as far as exercises go. But within 3 to 7 days, they are going to say whatever side the surgery was on, go ahead and start using your arm and your hand, just like you were if you were bathing, combing your hair, very little movement, but things like that. So you'll be able to start moving it a little bit more, and also, starting to increase the blood flow and the mobility in there. Another thing that you can do in that time to reduce swelling is if you're laying against a chair and you're just like this. Notice how my arms are down and the blood flow is going this way. Well, if this was the arm that I had, the side that I had surgery on, what I could do is prop it up on a pillow just like this. And they recommend 45 minutes 2 to 3 times a day. But once you're in this position, what you can do is open, and I don't know if you can see it in my video here. There we go. Open and just close your hand. And that's going to start building up some of the blood flow, the flexibility. Eventually it's going to start helping you, move your wrist a little bit more freely, move your elbow a little bit more freely, and move your shoulder a little bit more freely. So, you're affecting everything on the side here, and you want to make sure that you're going to let it heal before you go back into your regular routine. And it can be up to 8 months before you can get back into your routine the way you were before the surgery. But the most important thing is that you stay cancer-free and that you stay happy and you stay healthy throughout your recovery process. And if there's anything I can do in order to help, please contact me through workoutwithalyssa@gmail.com or workoutwithalyssa.com, and I'd be more than happy to help you, or at least get some resources to you if you find that you or a loved one is being faced with this terrible disease. And just remember that breast cancer, yes, it can be preventable, but we want to make sure we're catching it as early as possible if we are. So make sure you get your mammograms. Make sure you see your doctor once a year for your regular checkup, and then as well, always do self-exams too. But thank you very much. I hope everybody has a happy and healthy Halloween weekend, and I definitely hope that you've all just been brought a little bit more awareness to breast cancer, and know that all the research out there is really starting to pay off, and hopefully we'll continue to race for that cure.